Hello, I'm Derek Hine.
I'm Sam Pearson.
I'm Jackson Pfister.
And I am Drew Ridgway.
We decided to do our disease state project on multiple sclerosis. So the disease state of MS is defined as involving an immune-mediated process in which an abnormal response of the body's immune system is directed against the central nervous system. The CNS is made up of the brain, spinal cord, and optic nerves. The cause of MS is not known. Scientists believe that MS is triggered by a combination of factors. To identify the cause, research is ongoing in the areas of immunology, epidemiology, and genetics. Scientists are also studying infectious agents that may play a role in this disease. So, for a little bit of background on MS, multiple sclerosis is a slowly progressing disease and generally takes around 25 years to fully progress. It is most commonly diagnosed in females ages 20 to 40. However, it is also prevalent in males and in teens. Childhood MS is possible, however, it is very difficult to diagnose and it is very rare. Only about 2 to 5% of all people diagnosed with MS display symptoms before the age of 18. The most common symptoms of multiple sclerosis include weakness, fatigue, tingling, blurred vision, and pain in the head, back, and other extremities. Some less common symptoms that can present themselves with MS include sexual problems, bladder and bowel problems, speech and swallowing problems, problems with balance, thinking, and emotions, as well as vision problems. These symptoms usually present themselves in the form of MS attacks that can last for days or even months at a time. These attacks are generally followed by a remission period. However, this is not always the case, and some people do not experience remission at all.
So there are four types of MS. There's clinically isolated syndrome, which is more of the beginning stages of MS, and then there's relapsing remitting MS, and then secondary progressive MS, and then finally primary progressive MS. The clinically isolated syndrome, this is the beginning stages of MS, and essentially what happens is it lasts for 24 hours, and you start to see inflammation and demyelination in the central nervous system. And there's like two branches off of this. First being the monofocal episode, which essentially during this episode, it's a single like neurological sign or symptom starts to become prevalent, and we see an attack of optic neuritis, which it's caused by a single lesion. However, in multifocal episodes, this is there's more than one sign or symptom present in this, and there's still an attack on the optic neuritis, accompanied by like numbness or tingling in the legs, but the actual lesions themselves, there's just more than one. So in relapsing remitting MS, this is more of like the common disease course, like the secondary part, and it's characterized by clearly defined attacks of new or increasing neurological symptoms. Attacks are more commonly known as like relapses. You'll see that like throughout the presentation. We'll refer to them as relapses, and they're followed by partial or complete recovery. And during this recovery state, disease symptoms can disappear completely or may stay to remain more permanent. However, there's no progression of the disease during this period, so if it starts to show, it will end up like eventually just going back down to not being really prevalent at all. So here's a secondary progressive MS, which can be just called SPMS, and this is the second part of RRMS. And if you look to the right with the actual chart, it shows how with RRMS, it goes back down, and like there's no prevalency in like the disability. However, when SPMS hits, the actual disability starts to go up, and we start to see more and more signs happening. And this can be characterized by relapsing or active, which means it's just like MR activities being shown with this, or not active. And then we start to see progression, which is just the disease worsening with change over time, with or without the actual relapse happening, or without progression. And then the final one is primary progressive MS, which is more along the lines of like the final stages of MS. And this is characterized by worsening of neurological function without early relapse or remission at all. Now, the rate of progression may vary with occasional appletis and temporary minor improvements, but declining neurological progression is continuous. Follows the same categories as SPMS when we talk about whether it's active or not active, and if there's with progression or without progression. Now, about 15% of people with MS are actually diagnosed with PPMS, which is around 30,000 people. Right now, MS alone, it's around like 400,000 people in the United States, and it's about 2.3 million globally who are affected by MS. And then symptoms of PPMS can include trouble walking, vision problems, muscle weakness, difficulty staying balanced, paralysis, numbness, prickling sensations, dizziness, shakiness, difficulty thinking clearly, mood changes, depression, sexual dysfunction, and trouble with bladder or bowel control. And the chart on the right-hand side shows you that unlike SPMS, PPMS actually just starts right from the beginning and we see an incline in it. Whereas with SPMS, we have the RMS happening and it goes back down, no disability being shown, and then it slides back up. However, in PPMS, it goes straight from the start.
So, next slide. Treatments for initial signs of MS. So there is no known cure at this point for MS, but treatments focus basically on reducing and or controlling symptoms and managing their effects, as well as addressing the underlying immune disorder that causes the symptoms that manifest as a result of MS. Physical therapy is one treatment that is for managing symptoms. A physical or occupational therapist can teach you stretching and strengthening exercises and show you how to use devices to make it easier to perform daily tasks that may be impeded by the effects of MS. Also, muscle relaxants. You may experience painful or uncontrollable muscle stiffness or spasms, particularly in your legs. And muscle relaxants can help combat the effects of those symptoms. Muscle relaxants such as baclofen or Lioresal and tizanidine or Xanaflex may be common ones used. Medications also may be prescribed for depression, pain, sexual dysfunction, and bladder or bowel control problems that are associated with MS. Some people have such mild symptoms, however, that no treatment is necessary to manage their MS. So, treatment one for MS is Copaxone. Copaxone is the leading treatment for relapsing remitting form of MS, and it was approved in 1996 by the FDA. It comes in forms that can be taken once a day or 3 times a week via subdermal injection. Glatiramer acetate, which is the chemical name for Copaxone, stimulates myelin basic protein, which is a component of myelin that insulates the nerve fibers in the brain and spinal cord. And the myelin that is protecting is what's targeted by MS and is damage causing MS episodes. Copaxone blocks myelin damaging T cells through certain mechanisms in the body. It also reduces the frequency of relapses in patients with relapsing remitting MS and is also being approved for individuals who have experienced a first clinical episode or CIS and MRI features consistent with MS. Our second treatment is plasma exchange. So plasma is the liquid portion of your blood, and it's removed and separated from your blood cells. The blood cells are then mixed with a protein solution, albumin, and put back into your body. Plasma exchange may be used if your symptoms are new, severe, and haven't responded to steroids. People with some forms of multiple sclerosis use plasma exchange to manage sudden severe attacks sometimes called relapses or flare ups. Their plasma could have certain proteins that are attacking their own body. When you take out the plasma, you get rid of these proteins and symptoms may be reduced.
So, for treatments for relapsing or remitting MS, there are beta interferons. These medications are among the most commonly prescribed medications to treat MS. They are injected under the skin or into muscle and can reduce the frequency and severity of relapses. Glutamine acetates. These medications may help you block your immune system's attack on myelin and must be injected beneath the skin. Also, there's fingomeloid. This is a once daily oral medication which reduces relapse rates. Then, for some best selling MS drugs, decided to list some of the top multiple sclerosis drugs and what they produce yearly. There's Copaxone, which produces about $4.3 billion a year. There's Avonex, which produces about $3 billion a year. Gilena, which produces about $1.9 billion a year. Tysabri, which produces about $1.67 billion a year. And lastly, Betaseron, which produces about $1.05 billion a year. And those are about the top 5 leading MS drugs. And so, for some companies that are working on currently treating MS, some that have been around for several years, there's been Teva Pharmaceutical, which they first had their initial MS drug get approved by the FDA in 1996. And then next there's Novartis, which they started in 2010 with the initial approval of Gilena, which was a capsule-based relapsing MS treatment that is cleared for use in first-line and second-line MS cases. And it works by blocking some red blood cells in lymph nodes and curtailing their travel to the brain and spinal cords. Then there's Sanofi, which they created Ogba, which is a capsule-based relapsing MS drug. In trials, it was quite effective in reducing the relapse rate of MS patients, and it actually decreased it by 30% compared to placebo. However, they were recently slapped with a black box warning by the FDA, and that's because they had severe liver problems that can lead to death, and this has severely curbed their sales. In the second quarter, they only brought in about $44 million in sales. Some future companies that are working to treat MS right now are AbbVie, and they are testing a relapse remitting MS therapy drug, which is injected just once every 4 weeks. It's a humanized monoclonal antibody that works with IL-2 receptor pathways. It's in mid-stage trials right now, and it demonstrates about a 54 to 50% reduction in annualized relapses compared to the placebo. Currently, it's in phase 3 trials, and if everything goes according to plan, it could be on the market in the next 2 years. And lastly, there's Alzheimer's, which their goal is to create a long-term MS drug that has less long-term side effects on it. And the benefits of that is that it can have the same effective rates of the current MS drugs out there, but also improving the long-term health of patients that have the drug.
Thank you for watching.